Why is ESR important for lupus diagnosis? Lupus is a tricky disease to diagnose because its symptoms can look like many other conditions. It can cause fatigue, joint pain and swelling, skin rashes, especially the butterfly-shaped rash on the face, mouth sores, unexplained fevers, and sensitivity to sunlight. These symptoms often come and go in flare-ups, which makes it even more challenging to identify the disease early. Doctors use a combination of clinical evaluation, patient history, physical exams, and lab tests to diagnose lupus. There is no single test that confirms lupus on its own. Instead, they look at least for diagnostic criteria, including skin rashes, joint issues, mouth ulcers, and blood abnormalities such as low red or white blood cells or platelets. Blood tests are a key part of the process but are not definitive by themselves. The anti-nuclear antibody test is positive in almost all lupus patients, but it can also be positive in healthy people, so it cannot confirm lupus alone. More specific tests look for antibodies like anti-double-stranded DNA and anti-Smith antibodies, which help confirm the diagnosis after a positive ANA. Tests that measure organ function, such as kidney and liver tests, and markers of inflammation, like the erythrocyte sedimentation rate, are also used. The erythrocyte sedimentation rate, or ESR, measures how quickly red blood cells settle at the bottom of a test tube. It is a nonspecific marker of inflammation in the body. In lupus, ESR can be elevated during flare-ups when inflammation is active. However, a normal ESR does not rule out lupus, and an elevated ESR alone cannot diagnose it. It is just one piece of the puzzle, helping doctors understand if there is ongoing inflammation and how active the disease might be. Urinalysis is often performed to check for kidney involvement, which is common in lupus. If there is protein or blood in the urine, it suggests kidney issues. Sometimes, a biopsy of the skin or kidney tissue is needed if organ damage is suspected. Ultimately, diagnosing lupus involves ruling out other diseases with similar symptoms, which often requires consultation with a rheumatologist. In summary, ESR is an important part of the diagnostic process because it provides information about inflammation levels, helping doctors assess disease activity. But it is not a standalone test for lupus. Diagnosis is a careful, step-by-step process guided by established medical criteria and multiple laboratory tests. If you suspect lupus, it is essential to seek professional medical evaluation. Remember, lupus diagnosis is personalized and may evolve over time as symptoms change. Always consult healthcare professionals for accurate diagnosis and appropriate management.